Well, I've known Paul Steinkuller for many, many years, and he has worked in many countries without seeking the limelight. He's been in Kenya, Malawi, and also Madagascar.
Dr. Paul Steinkuller is an unsung hero because of the work that he has done in reducing the prevalence of blindness and because of his humanity, and he's been inspirational to students and patients alike and also to his colleagues.
My family and I went to Nakuru, Kenya in 1980. I was struck by how I was now seeing the end stage of various diseases I had only read about. And the people who were blind were mostly blind because of cataract. When we went out on a safari, as we did to visit outlying hospitals, we would take all of our ophthalmology equipment with us, including all of the instruments, a operating light, which was an automobile headlight, and the power for it was supplied by an automobile battery. And the first time we implanted an intraocular lens in a child, I recall it very clearly. We were doing our morning rounds the day after surgery and taking off the patch that had been put on right after surgery. And this young child, who was 6 or 7 at the time, we removed his patch and he looked around. And he could see his mother for the first time in several years. And we all cried. The impact of cataract surgery and glaucoma surgery in developing countries is extraordinary. You're taking people who are basically blind when they arrive at the clinic, commonly led by a child or even carried on the back of an adult because they could not see anything, to leaving the hospital a few days later, not wearing glasses, and they're able to walk by themselves home several miles.